Our next guest, we've been waiting all day for all of these lovely guests. Heather is going to join us tonight as our last speaker. And Heather will come to us. She's a U.S. trained CNM, certified nurse midwife, currently living in Ecuador. Hi, welcome. Will you give us your introduction?
Sure. I just want to say thank you so much for inviting me to participate in this wonderful forum for all of these different midwives. And I just want to say I admire everyone's journey and path that they've been on and sharing all of this information with us today because, you know, we have so much more in common than people would think, right? But it's just absolutely wonderful. I wish I could have heard everyone speak, but unfortunately I don't have enough internet to to keep me going for 8 hours. So.
We recorded it, so you will share the links. Yep.
So I'm really grateful that I could be here today and I was invited. So thank you so much. So my name is Heather Mena, and I am a RN and a CNM. So I'm a certified nurse midwife from the United States. And I am currently living in Ecuador. My husband is Ecuadorian, and I have lived on and off in Ecuador since 2003. We have 3 kids together, and let's see here. We try to figure out. So I've been a nurse since for a little over 12 years, and worked mostly in pediatric ICU, so high acuity settings. And with the birth of my first child, which was in the United States, I had a really traumatic birth experience, and it was very negative. And I was a victim of obstetric violence, and it just didn't sit well with me. I had this, you know, all these desires and hopes to have this, you know, natural birth, and it didn't end up that way. And so with the birth of my second child, I was on a search to find something different. And so essentially, the state that I was living in at the time was Illinois, and Illinois had really high, they have lots of restrictions on midwives. And the fact that I worked in a hospital in a high acuity setting, a lot of my colleagues were, when I told them I thought about having a home birth, they were like, no, everything's going to go wrong. And so, you know, I ended up finding a midwife that was an hour and a half away from me, but I was determined with all the research that I did that I really wanted to have this birth with a midwife. And so I ended up having the birth, and it was a beautiful experience. I had a water birth, and I had a doula present as well. I had a very precipitous labor, so I didn't get to spend a lot of time with them, but the time that I did spend was completely different than my first experience. And so from that period on, every time I went in for a prenatal care visit or to talk with my midwife, I was like, this is what I want to do. I want to do this for other women. I want to be the person that empowers them. I want to be the educator. I want to give them choices and options. And so ever since that time, I decided that this was my path and this was the journey that I was going to take. It took me kind of a long time to get to where I wanted to be. But I graduated as a certified nurse midwife in 2018. However, as a certified nurse midwife, I was heavily medicalized. I mean, I did a lot of in-hospital work. I got a lot of good experience. However, for me, with all of the in-hospital experience that I had and the critical care background, I really wanted to know what it was like to do out-of-hospital birth. And that was really, really fascinating to me, to go back to the basics and back to the roots of where midwifery came from. And so for me, it was really important. My husband wanted to move back to Ecuador, and so I was trying to find a way that I could combine midwifery and move back to Ecuador. And so I actually applied for a grant to study and to research traditional midwives in Ecuador. And I received that grant. And so basically the premise of my study was to study traditional midwives, their practices, and the medicinal plant use. And so I began my study in September of 2019. And essentially the study was to look at 3 different regions of Ecuador. There's the coastal region, the highlands region, and the like Amazon region. Traditional midwifery is really has been preserved more so in the areas where there is highly more indigenous people or a higher indigenous population. The indigenous population of Ecuador is about 25 to 35% here. And so my first place was essentially what I wanted to do was be in the community and try to, one, earn the confidence and respect of these people that I was working with, these individuals, try to understand their culture a little bit better, and observe some of their practices and their techniques. So first I was in the jungle, and I was able to be part of 6 births. I am in awe of these women. They are some of the most strong and resilient women that I've ever seen. They have, the indigenous population in Ecuador has bore the brunt of a lot of discrimination, and I don't think that they're, hearing this from them, they just have faced a lot of issues and problems. So going back to the background of Ecuador in general, and I can't tell you the exact time, but the Spanish, sorry, I'm trying to speak in English and not use my Spanish and English at the same time. Conquested Ecuador. And so there is a very interesting population here, or the demographics are very interesting. So you have what they would call white people here, which are mostly Spanish descendants. And then you have mestizos, mestizos are like half and half. So they're basically the product of a Spanish and indigenous relationship. And then you have Afro-Ecuadorians. And then you have, that was 4, right? Yeah, that's pretty much the majority of the population here. And like I said, 25 to 35% of the population is indigenous. And so, sorry, I'm going to go back to my thing where I have all my info. And like I said, that's where the majority of people, where traditional midwifery has really been preserved. So after spending about 3 months with these midwives and being able to participate in 6 different births, I started to recognize the things that needed to be done, and things that basically, this is from my perspective, right? And so it was really important for me to realize and respect their cultural practices. However, I started to notice that there were some definite deficiencies and safety issues in the practice. And so that was my first concern, I guess you could say. We spoke with a lot of the women. I spoke with a lot of the women, and I had a really good relationship with them. I want to be able to make sustainable change. However, that sustainable change can't come from me. It has to come from the actual community wanting to have that change, right? And so I feel like because of this discrimination that they've had in the past, they've had a lot of people, NGOs, the government, all of these people are coming in and telling them how they need to change, how they need to, this is wrong, this is, and that was the last thing that I wanted to do. Because I feel like these women are extremely wise. They have been holding a space for birth for so many generations. And so it was really important that they were interested in making these changes. However, at the same time, that they were knowledgeable and that they knew that, if they continued to practice the way that they're practicing, that something could go wrong. And so, sorry, I'm in my office. This is my car, because my kids we live in a camper, and so there's not a lot of space for us to get any privacy. So I apologize that there's no white background in the back, but this is as good as we're going to get today. So if you see any kids pop in the back, I'm sorry. So sorry, this is very preliminary, all of my research. Basically, this is the first time that I'm kind of putting everything together because I've only been able to get through 2/3 of my research. I've done the jungle and the coast, and I was just about to go to the Highlands region, which is actually the most recognized area where the most traditional midwifery is present. So I was really excited about that, but I don't know if it's going to happen, especially now with the pandemic. But we're just taking it day by day. So essentially, what I found was that these women are really invested. They're invested in helping their communities. They want to help the families, women, but there's a huge trust issue, and so people coming in from the outside, me coming in and telling them, okay, like this is how you need to do it, that's not what I wanted to do, nor is that going to make sustainable change. And so, to be honest, I haven't found the perfect way to make these things happen. So here in Ecuador, there's 3 ways that people can get healthcare. There's the public healthcare system, which provides free healthcare to everyone. There is the Social Security system, which is most people that have a job that, for the government or through a big corporation, they would be paid. Their job pays for them to receive services. It's called the Social Security system. And then there's private insurance. And so the private insurance is about 3% of the population. It's for the wealthy. The majority of people receive care through the public healthcare system because it's free and because people don't have to pay for it. And so what's happened is that their traditional midwives, at one time in 2008, this is when it became completely free. At one time before that, it was low cost healthcare, high quality care. And so midwives, what happened was that when that turned into a free service through the public healthcare system, the traditional midwives saw a huge decline in the amount of women that came to see them. And so the organization that I was working with was a group of 10 midwives. They're called parteras in Ecuador. And in 2018, the year before I came, they had only 8 births. And so if you think about that, there's 10 midwives and only 8 births. So, I mean, that's not even 1 birth for every single one of them. And then depending upon whoever's, on call or whoever's present at the facility, you might not have even had, 1 birth in a whole year. And so this has been going on since 2008. And so many of these women have only caught 2 babies in, 10 years or 12 years. Or there's other women that have caught more. But what happens when you have a decline in these numbers, you forget what's important. And not only that is that you aren't continually learning. And so I think continued education is really important for all of us. However, culturally speaking, I don't think that is something that that's not a priority for them. And so I think these women have 1 foot in the Occidental world and 1 foot in, the ancestral world. And so it makes it really hard to bridge providing care when the rest of the community is receiving these the care from the a medical model and also the free healthcare. So so basically what I found, and I'm still going through all of my research, is the midwives have a highly variable level of skill across the country with each individual midwife. I came across midwives that were, beyond prepared. They had, they would bring out their midwifery bag, and they would show me everything that they had inside of it. Many have received repeated trainings from UNFPA, from the Ministry of Health. The European Union has done a lot of education here in Ecuador. They've also had a lot of private organizations and NGOs that have come and tried to give, different conferences on suturing, on, recognizing obstetric emergencies, lots of different things. And so I feel like with every single midwife, I found a different level of understanding and knowledge base. And then, there were midwives that have only caught 3 babies total. And, they were looked upon as a midwife in their community, but they had very little preparation and very little understanding of what a physiologic birth is. And then, let's see here. And then the last thing that I found with the midwives is that almost all of them, the midwives that I worked with, demonstrated that they have adapted some form of the care that they provide because of experiences or trainings that they've received. So almost all of the traditional midwifery is not 100% traditional anymore. I think there's things that have, that they've changed over time because people have exposed them to different techniques. And a lot of the things, some of these techniques might have been good 15, 20 years ago, but now are no longer utilized. And so that's why it's really important that they continue to be updated. Most women here, if they are seen by a traditional midwife, they're also being seen by a public health, someone in the public healthcare system, because those visits are free. They can get their ultrasound done with them. They can get all of their labs done with them. The other thing that I found here is that the Ministry of Public Health, essentially at one time they were trying to get more midwives updated and actualized with information so that they could provide better care to people, because there's a lot of places that are rural in Ecuador that there are no healthcare centers close to, or people don't have buses or transportation that they can take to get to these places. And so because they're so isolated, it's really important that they have traditional midwives there that can take care of these women if for some reason they have a precipitous birth, or for some reason they can't get to a hospital or a healthcare center. So at one time, the Ministry of Public Health was actively working to try to train midwives and get them into a position where they could provide adequate services, and care to women and families. Let's see here. The other thing that was really disappointing to find was that from talking to different women, I feel that obstetric violence is found in all healthcare settings here, in with traditional midwives, and also in the Ministry of Public Health, in the private healthcare settings. And so I don't know if there's a new movement from Spain, which is called El Parto es Nuestro. It's basically birth is ours. And I was able to attend one of the meetings in the capital here in Quito. And they have been doing a really great job of trying to get more information out about obstetric violence, about prenatal care, about things that, what you are looking for, and that you don't have to accept being treated a certain way. And that, obstetric violence is not okay. And I think many people and many women have just succumbed to the fact that, okay, well, everyone is treated like that, so that's just what we're going to get. And so I think through education and letting people know that that is not okay, and that's not acceptable form of care for any woman, hopefully that will help bring that into the light and not let people treat others like that. The other big thing that I found is that most midwives are parteras. They feel very isolated and unsupported by the government. Like I said before, they feel that they've been discriminated against by many people. And there is not essentially a formalized midwifery education in Ecuador. And so there's the traditional midwives, and then I've come across, I've met some women that are nurses that have become midwives or parteras through different trainings, and then also working as like an apprentice with a traditional midwife. But there is no formalized midwifery education in Ecuador. The closest thing to a midwife in Ecuador is an obstetriz or an obstetra, which is like an obstetrician. That's a 5-year university program, but it's a highly medical model of care. And so you don't see the emphasis on physiologic birth. And most obstetras or obstetricians work either in only primary care or intrapartum. They don't do both. And let's see what else. The Ministry of Public Health have recruited a lot of the traditional midwives to work within their communities, basically to be the eyes and ears of the healthcare center. They tell them that they want them to let them know about all different pregnant women, if they think that they might have a complication, or if women are not attending prenatal visits. They basically go out to their houses and tell them that the obstetra or the obstetrician needs to see them. The obstetras are highly discouraging the midwives or the parteras from catching babies or being present at deliveries. They are telling them that it's dangerous and they will be sent to jail if anything happens to the mother or baby, and that they should not be providing care to them unless it's an absolute emergency. Midwives are also told not to give any medicinal plants that can induce labor. This is what the formal public healthcare system is saying to the traditional midwives. So basically I'm sorry, that was kind of disorganized. But basically the things that I feel like that I've learned from this experience and things that could use improvement are hygiene. The majority of the traditional midwives that I watched or worked with and observed during birth, they were not good about washing their hands. Many of them didn't wash their hands at all. The majority of them did not use gloves. They had repeated number of cervical checks. That's without gloves. There wasn't a lot of emotional support being provided. I also didn't see a lot of freedom of movement in childbirth. I have not seen personally any women give birth in the public healthcare sector. However, from what I've been told by women who have given birth in the public healthcare sector, that they have a very limited options of giving birth. Basically, it's in the semi-Fowler's position, in bed. There was a movement in Ecuador in the mid-2000s, so like around 2005 to 2008, where they wanted to have vertical births because that is an indigenous cultural practice. And so some hospitals did adopt that practice. However, it really just depends on the training that the doctor or the director of the hospital has had and what they feel about, cultural and ancestral traditions, and if they feel like making that part of the practice at their hospital. Another thing that I've seen here is that there's not a lot of options for women. They have the free healthcare system. However, once they're there, I've heard horror stories of them, being yelled at, pinched for making too much noise during giving birth. There's no informed consent. They do things to the women without asking them if that's something that they want to do. And then basically just a lack of continued education and updating. Things that I see as barriers to this change are basically cultural preservation and lack of trust to outsiders. And outsiders could be, people from Ecuador, but they're trying to, enter into an indigenous community, but they're not from there. And so they're very wary of trusting those people because they have been burned in the past and taken advantage of. The other thing is barriers to that change is trying to get the two to collaborate. So the public healthcare system and traditional midwives. I've really worked to try to broach those two, and I feel like in some areas it works better than others. But like I said, again, that trust is really huge. I think it would be amazing to see a nationally organized, a nationally recognized like traditional midwives organization or something like that, where they could communicate with each other, they could support each other, and they could continue to receive education. However, that is a lot of work, and I don't know, just because money wise and funding, that's not super easy to do. So basically, you know, this has been an incredibly emotional experience for me. I've made really great relationships with some of these women. They, like I said before, they're so resilient, and they have worked so hard to improve their communities, improve the maternal mortality rate in their country, and just help their community. However, I feel like there is definitely some deficiencies here, and I feel like implementing change is not super easy. And so that's why I feel it's so important that we have skilled birth workers throughout the world. However, I know that Amiel, I think was her name, she mentioned, you know, trying to combine the middle ground and trying to combine, you know, the spiritual side and the scientific side is sometimes a lot more challenging than we anticipate, you know, because I think they're both so important. We have to know what physiologic birth looks like and what it is in order to really sit with that. You know, they call it watchful waiting. You know, you know what to expect, and so you're okay to sit there. But if you don't know what to expect, people rush things, they intervene, they do interventions, and I think that's what we're trying to avoid if possible. I mean, interventions are there for a reason, but they don't all need to be intervened on. And so it's been a really interesting experience for me. Because I'm a newer midwife, I don't feel like I'm at the point where I could go in and just you know, change all of these things, because I feel like I'm still learning as a practitioner. And so yeah, it's a lot to take in. So I hope that you guys understood what I was talking about, and I really appreciate that you guys took the time to listen to me. If you have any questions, I'm going to take it back to Layla and Augustine. So thank you.
It was so lovely a speech, and it was so breathtaking. I could feel the passion in your eyes and your speech. I wish I was there to join you in this noble mission, and really I appreciate you. I appreciate you and I honor of you. God bless you. I'm proud of you, and all of midwives are proud of you.